The Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori, actively participated in the recently concluded 2024 Nigeria Health Sector-wide Joint Annual Review organized by the Federal Ministry of Health and Social Welfare. This three-day gathering brought together key stakeholders to reassess performance and highlight achievements under the newly launched sector-wide approach, SWAP.
It's the first of its kind, and after the coming on board of President Bola Ahmed Tinubu and of course the Coordinating Minister for Health and Social Welfare. So a lot of innovations were put in place under this SWAP, that sector-wide approach. I know this is a one-year post-review, and I'm here as the DG of NACA because NACA, as you know, is a multi-sectorial agency that's supposed to be responsible for the multi-sectorial coordination, of health and non-health issues related to HIV/AIDS in the country. And therefore, we also have some indicators that we are measuring, working closely with the subnationals to ensure that we actually, achieve the global target of eradicating HIV/AIDS by the year 2030.
In his address, the Coordinating Minister for Health and Social Welfare, Professor Muhammad Ali Pate, underscored the importance of collective efforts in building a healthier society.
Let me specifically use this occasion to express our profound appreciation to His Excellency President Bola Ahmed Tinubu, GCFR, for his incredible and visionary leadership, placing the health and social well-being of Nigerians as a core part of his renewed hope agenda by significantly increasing the allocation of the federal government's budget to health and social sectors in 2024. I will call all of us to action because the task ahead of us is huge, but it requires our collective efforts, and we can do this through genuine partnerships that are respectful. We call on all of government and all of society approach, including our development partners, the Friends of Nigeria, to continue to work with us, to be patient with us as we chart a path towards improving the health of all Nigerians.
The event featured a series of keynote addresses, technical review sessions, and high-level political discussions aimed at driving Nigeria's health priorities forward.
For me, the health sector deployment is a homecoming, as my passion for a change in the narrative of the Nigerian healthcare delivery system have taken me to several parts of our country, either as a practicing physician, a health activist, or an active contributor to the health sector policy initiative that drive progress, particularly at the subnational level. We must focus on those critical indicators that are the windows through which our health system is addressed, such as mortality rates, disease incidences, service utilization rates, life expectancy at birth, health expenditure, and so on. Importantly, the quality of care that we provide and the client experience when they access our services must be a top priority as we work together to put them in the upward swing and deliver on the Renew Hope agenda.
Dr. Ilori highlighted the challenge of mother-to-child transmission of HIV and relayed ongoing efforts to tackle it.
Eliminating mother-to-child transmission is very key and I'm very passionate about that. Nigeria unfortunately has a huge burden now, and the narrative is not very encouraging to us. And therefore, the wisdom of the Federal Ministry of Health under the able leadership of the Coordinating Minister and the former Minister for State for Health, an acceleration committee was put together. And the whole essence, the objective of the acceleration committee was to provide oversight functions for all the other organs of the government that is working along eliminating or preventing mother-to-child transmission. And the whole idea is that we want to ensure that every mother registers for antenatal care. We want to ensure that every pregnant woman that is HIV positive is found, and if positive is put on treatment. We want to ensure that every child that is HIV exposed is put on the necessary medication. We want to ensure that going forward, no child is born with HIV/AIDS. We want to reduce the huge burden of pediatric HIV that is with us, and also the huge burden of pregnant women with HIV status.
The successful completion of the 2024 Nigeria Health Sector-wide Joint Annual Review marks a significant milestone in the federal government's efforts to strengthen the nation's healthcare system and improve health outcomes nationwide. Delegates from Wondfo Biotech, manufacturers of HIV test kits, led by the Country Representative Bravo Otohabru, paid a courtesy visit to the National Agency for the Control of AIDS, NACA. Welcoming the delegation, Dr. Temitope Ilori, Director General of NACA, commended the firm for their generous gesture and called for the local production of essential HIV commodities.
I know a few months ago, far away in China, the Wondfo community actually signed an MOU with PIVAC, our Unlocking the Value Chain initiative of the President Bola Ahmed Tinubu, in trying to ensure that we have domestic production of reagents, of test kits, and other HIV. And I want to commend you for that initiative, and we look forward to having domestic plants here in Nigeria.
As part of their contribution to the upcoming World AIDS Day celebration, the visitors donated 2,000 self-test HIV kits and 2,000 professional HIV test kits for health facilities, both of which are pre-qualified by the World Health Organization and registered with the National Agency for Food and Drug Administration and Control, NAFDAC.
At the moment, I'm really excited to tell you that beyond NACA here, we also have a representative here, local representative that is reaching out to our private pharmacy shops. So they are sending these commodities, these self-test kits to private pharmacy outlets, at a subsidized rate, so that people can walk in, pick this test kit in the comfort of their room. They can test themselves. If they are reactive, the advice is that they should not panic. Go to a nearby hospital where HIV testing can be done again. They can repeat it there before we can say, okay, they are confirmed as HIV positive. So we are really going a long way to help the public, because sometimes a lot of people are going around there, they don't know that they're even carrying the virus. The fact that someone is tested today is negative does not mean that it's negative forever. So it's still very important we continue to move ahead with all these activities that make everybody to be aware, to know their status, HIV status. Is very important. That is the starting point. Once you know that, then all other areas involved in HIV management can easily come in.
The partnership between Wondfo Biotech and NACA highlights the importance of continued collaboration in the fight against HIV.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.